We'll move on to the chemodenervation of the extraocular muscle. What happens here, conditions like exophthalmic goiter, which is actually a kind of a hyperthyroidism. In this case, the physician is going to inject this botulinum toxin into the eye structure, especially into these muscles, because in order to cause a kind of paralysis, when there is too much of an hyperactivity, this botulinum toxin will cause the muscle to prevent some kind of spasm. Next, like retrobulbar injections are given behind the globe of the eyes. We also have like so much of bulbar blocks. It's like injections are also given into the eye. Coming to tarsorrhaphy, tarso, which is nothing but the eyelids or the tarsal plates, rhaphy is repair. So the physician is going to repair the tarsal plates. So we also have canthorrhaphy. So here what can happen is, what is a canthus? We have the upper and the lower eyelids, the meeting point, where these two eyelids converge either medially or laterally, we call that as a canthus. A repair on the canthus would qualify as a canthorrhaphy. So we also have something called median tarsorrhaphy. In that case, what happens is, imagine a person has been just undergone this corneal grafting. So for him, they should close their eyelids, right? So they do something called a median tarsorrhaphy, where they will put sutures and they will tie up both the eyelids. This is being done temporarily so that to protect the eye graft.